Hi, this is Alex Governale of the Regis University DPT program. This will be a discussion on the force capacity and EMG response of the wrist musculature, specifically as they relate to non-standard positioning. Handheld dynamometers are excellent tools for the measurement of muscle contraction forces in clinical settings. Here, we use one such instrument, along with EMG data, to estimate the maximum force capabilities of the wrist under various conditions. Literature suggests that skeletal muscle will experience a decrease in force production capabilities in shortened or lengthened states. Our purpose here was to investigate these length tension properties as they apply to the wrist. We wanted to demonstrate evidence of active insufficiency or a decrease in force production by using non-standard positioning to vary muscle length. 8 subjects were recruited through the Regis DPT program for participation. The 4 male and 4 female subjects fit the demographics shown in Table 1. Inclusion criteria consisted of a willingness to participate in the study and no knowledge of pain or limitations in the wrist. Any student that was absent from class on the day of the study or was sensitive to the testing requirements was excluded. To begin our procedure, the subject's arm was cleaned and shaved in order to guarantee EMG electrode adhesion. After the subject was instructed to sit down, the electrodes were placed over the flexor and extensor muscle groups of the wrist. Initial recordings of resistance contractions confirmed that the placement was accurate. The hand grip dynamometer was adjusted so that the proximal interphalangeal joints contacted the grip and the metacarpophalangeal joints were in a neutral position. With the arm held at the side of the body, the elbow at 90 degrees, and the elbow about 2 inches away from the body, we were able to take measurements for our standard position. The subject was instructed to tense their hand as hard as possible for a few seconds and attempt to limit the contraction to just the wrist. We obtained a force measurement in kilograms from the face of the dynamometer and maximum EMG values in microvolts through our recording software. Similar measurements were then taken under 4 varying conditions. The grip of the dynamometer was shortened in the first test and then lengthened in the second. Then, with a standard grip, the wrist was placed in maximal extension for a reading, and then finally in maximal flexion. We then proceeded to analyze our data from a statistical perspective. To do so, all test data was normalized to the measurements from our very first test, the one in standard position. By dividing each measurement by its standard position value, we were able to define the data as a percentage of its standard position value. The mean and standard deviations of these normalized values were also calculated for each of the testing conditions. Our error was defined as plus or minus 1 standard deviation from the calculated mean. As shown in Figure 1, we did in fact observe a decrease in the force production capabilities of the musculature when the wrist was placed in both flexed and extended positions. This is consistent with the findings of Lee et al. Furthermore, our results suggest that this attenuation of force was greater in the flexed position than the extended position. The non-standard grip lengths of the dynamometer, both short and long, also resulted in diminished force capabilities, supporting our hypothesis. These findings are clinically applicable to a variety of patients, specifically those who may have muscle weakness in their wrist due to injury, disease, or old age. In order to maximize the wrist strength of these patients in daily activities, it is important to keep their wrist in a neutral position. In addition, caution must be taken when members of these populations attempt to grip objects or supports that force them into a non-standard grip, as this will lead to decreased grip strength. For example, if an elderly patient is walking up the stairs, the railing used for support must not be too thin or too thick for their hands, as this may put them at a greater fall risk. Thank you very much for your time, and have a great day.